UK Healthcare Community Connection is sponsored by UK Healthcare.
To align with new regulations, hospitals across the nation will be implementing social drivers of health screenings in January of 2024.
Today, Chief Diversity and Health Equity Officer Dr. Tukea Talbert on the left and Executive Director of Population Health Dr. Jessica Sass from UK Healthcare are with us in studio, and we're so glad to have them here for this important initiative. For those of the folks out there watching this morning, what are social health drivers?
Okay, so social drivers of health, they come under a few names, so people may recognize them as also health-related social needs, also social determinants of health, but these are really circumstances or conditions in the environment where people live, where they grow, where they're born, where they pray, play, work, that influence their health and their health outcomes. And these conditions may or may not be within the control of individuals. So at UK Healthcare, when we launch this initiative in January, we will be looking at 5 key domains that we will screen patients for. And those will include food insecurity, which is people's ability to be able to access healthy or adequate food choices and afford them. Also transportation. We'll look at financial and utility difficulties, housing, as well as interpersonal safety. And typically in the community, there are agencies and organizations that can help people with these things. So we will screen and connect people with these agencies for help.
And why is it so important to consider these social drivers of health?
You know, that's a great question. It's so important because studies show that almost 80% of an individual's ability to reach their optimal health and health outcomes are related to social drivers of health. So they're pretty key.
And you may have touched on it in your first answer, but just if there was anything else to add, how will UK Healthcare address these social drivers of health?
Okay, and it will be through screening, but I am also going to turn to Dr. Sass, my colleague, to talk a little more about that process.
Please, yes.
So we will be asking all adult inpatient and adult and pediatric primary care patients questions to determine their risk for social drivers of health. It is important for patients to share this information with us because we want to make sure patients can be the healthiest they can be. And access or having social drivers of health can affect access to healthy food, be able to afford medications. And so by asking these questions, we can then identify patients at risk and link them to community-based organizations. UK Healthcare collaborates with these organizations to link patients to local resources. And this initiative really reinforces UK's healthcare commitment to patient-centered care.
Absolutely. I mean, a lot of exciting things to look forward to in the new year. Exciting initiative for sure. Thank you so much, ladies, for joining us this morning. I'll be right back with your final half hour or so of news after the break.